The committee will come to order. At the conclusion of opening statements yesterday, the chair called up H.R. 4365, and the bill was open for amendment at any point. Chair recognized Mr. Butterfield for the purpose of offering amendment in the nature of substitute, and the clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 4365 offered by Mr. Butterfield.
Without objection, the reading of the amendments dispensed with, and Mr. Butterfield is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. Mr. Chairman, I'm at a huge disadvantage right now. I don't have my file. If you could just bear with me for just a moment. I think I beat my staff here. Yes.
All right.
Yes. Can someone help me find? Yeah. Can you go to the next one? So this is the substitute.
Yeah, this is amendment in the nature of substitute. You just yield to Pallone.
Yeah, that's fine. Do you have to strike the last word?
Oh, your bill?
No, I mean, I could do.
Your statement? Yeah, go ahead.
I yield to the ranking member, Mr. Chairman.
Now, don't yield your time. I'll just take my own.
All right.
I'll take my own, Mr. Chairman.
Okay, the chair recognizes Mr. Pallone. 5 minutes.
I move to strike the last word in conjunction with the amendment in the nature of a substitute. Emergency service professionals play a critical role in our nation's trauma system. We depend on our emergency medical system to provide the services necessary to save lives and prevent disability. To facilitate quality care, we must make certain that emergency medical service, EMS professionals, have the flexibility they need under federal law to treat patients in emergency situations. We first discussed H.R. 4365 in July at a subcommittee hearing on strengthening our national trauma system, and I shared at the time that while I supported the intent of the legislation, I believed it was important to ensure proper safeguards under the Act to limit the potential for diversion or misuse of controlled substances. And I believe the amendment in the nature of a substitute offered by Mr. Butterfield strikes the right balance. The proposed changes ensure EMS professionals have needed flexibility to respond during emergency situations while preserving DEA's ability to effectively enforce controlled substance laws and regulations. And while some of the changes are technical in nature, there are other changes that I believe are critical to effectuating the intent of this legislation. For example, first, requiring an EMS agency to notify DEA 30 days before delivering or storing a controlled substance at any designated location. This will help ensure DEA has information regarding where an EMS agency is delivering or storing controlled substances while retaining the single registration requirement. Second, revising to make clear that an EMS agency may use a standing order that was adopted but not issued by the EMS medical director to reflect the current practice of many EMS agencies that rely on regional standing orders. And third, clarifying that it is the responsibility of the registered EMS agency to ensure all EMS professionals comply with requirements of the Act, maintain required records in specified locations, and comply with physical security requirements established in DEA regulations. So the changes made in the amendment in the nature of the substitute will allow both EMS professionals and DEA to achieve their respective missions. And I want to thank Mr. Butterfield for his work and the work of others on this legislation, and I would urge members to support it. And I yield back. Thank you.
Thanks, gentlemen. Now recognize Mr. Butterfield for 5 minutes in support of the.
Thank you very much, Mr. Chairman. And again, I apologize, but the amendment has arrived. Mr. Chairman, the amendment reflects bipartisan improvements to H.R. 4365, the Protecting Patient Access to Emergency Medications Act of 2016 that Mr. Hudson and I introduced back in February. We've worked closely with the National Association of EMS Physicians, the National Association of EMTs, the Association of Air Medical Services, the Association of Critical Care Transport, the Emergency Nurses Association, and the American Hospital Association, among others, to ensure that life-saving medications can continue to be administered to people in emergency situations. This amendment reflects many of the needs of the first responder community and balances those of the U.S. Drug Enforcement Agency. This important bill is about saving lives, and this amendment will improve this bill, in my opinion, to help assist with that. The purpose of the legislation is to guarantee that EMS personnel under the supervision of a doctor can administer life-saving medications to patients in their care. The bill helps to codify existing practice, and it ensures EMS personnel have the necessary tools to help victims of traumatic events receive medically appropriate treatments before arriving at the hospital or clinics. In rural areas and congested urban areas alike, hospitals and clinics can be difficult to access. In many cases, the immediate administration of treatments can prevent death or permanent disability. The amendment helps improve the clarity and scope of the bill, allows EMS agencies that use regional standing orders to continue to do so. It also provides the DEA with the ability to prevent drug diversion and ensures adequate security and record keeping. I applaud Mr. Hudson, the committee staff, the stakeholders. I even commend my own personal staff, even though it was a couple of minutes late, for reaching this bipartisan agreement to help move this legislation forward. I thank you for your indulgence, Mr. Chairman. I yield back.
Chair, thanks, gentlemen. Are there bipartisan amendments to the amendment? Are there other amendments? I want to thank Representative Hudson and Butterfield for their continuing efforts on H.R. 4365, the Protecting Patient Access to Emergency Medication Act. This is a good bill that would enable our nation's emergency medical service professionals to continue to provide quality emergency care and recognize the unique nature of their practice. I also want to thank the bipartisan committee staff for working with a range of stakeholders and the Drug Enforcement Administration on improvements to the bill that are reflected in the amendment offered by Representative Butterfield. It is my understanding that they will continue to work on a bipartisan basis prior to the full committee in order to iron out some outstanding issues, but I support the amendment and I urge my colleagues to vote yes. Is there anyone else seeking recognition? If there's no further discussion, the vote occurs on the amendment in the nature of a substitute. All those in favor shall signify by saying aye. Aye. All those opposed, no. The ayes have it, and the amendment in the nature of a substitute is agreed to. The question now occurs on forwarding H.R. 4365 as amended to the full committee. All those in favor say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the bill is agreed to. Chair now calls up H.R. 1192 and asks the clerk to report.
H.R. 1192, to amend the Public Health Service Act to foster more effective implementations and coordination of clinical care for people with pre-diabetes, diabetes, and chronic disease and conditions that may result in diabetes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Chair recognizes himself for the purpose of offering an amendment in the nature of a substitute, and the clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 1192, offered by Mr. Pitts.
Without objection, the reading of the amendment is dispensed with, and the chair recognizes himself for 5 minutes on the amendment. This amendment expands the scope of the National Clinical Care Commission to look not only at diabetes, but other related autoimmune and metabolic disorders. This will provide for better coordination across a wider spectrum of illnesses and disorders, and I urge my colleagues to support this amendment. Are there bipartisan amendments to the amendment? Are there other amendments? There are no amendments. Is there any other discussion? If there's no further discussion, the vote occurs on the amendment in the nature of a substitute. All those in favor shall signify by saying aye. Aye. All those opposed, no. The ayes have it, and the amendment in the nature of a substitute is agreed to. The question now occurs on forwarding H.R. 1192 as amended to the full committee. All those in favor say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the bill is agreed to. The chair now calls up H.R. 1209 and asks the clerk to report.
H.R. 1209, to amend the Public Health Service Act to provide for the designation of maternity care health professional shortage areas.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there bipartisan amendments to the bill? Are there other amendments? All right, then the question, the chair recognizes the gentlelady from California, Ms. Capps. Strike the last words.
Brief, but I did want to make a couple of points about this important legislation. Healthy women make healthy moms and make healthy babies. I guess that's sort of goes without saying. But to support these women throughout their lives, they need access to preconception, prenatal, and postpartum and interpartum care. So the National Health Service Corps is one of our most effective programs to improve access to care in underserved areas. And maternity care professionals are already included in the program and doing great work in communities across the country. But at present, these providers' placement is based on data looking at primary access shortages without regard to maternity care data. So while they're doing important work, there's more we can and should do to ensure that they reach the areas that would benefit most from high-quality maternity care. So our bill would ensure that the National Health Service Corps take the steps to use data to help more accurately place maternity care professionals in the locations that need them the most. Healthy women make healthy moms and make healthy babies. This is a meaningful change that can have significant impacts on a woman, on her family, and her community. That's why I'm proud to have worked closely with Dr. Burgess to co-author this legislation. I want to highlight the work of our colleague, Representative Roybal Allard, who has also worked to address this discrepancy. So I urge full support of this legislation.
Will the gentlelady yield?
Of course.
I want to thank Representative Capps for working with us on 1209, H.R. 1209, and this is an important step to address critical shortages of maternity care across the country. This bill is narrowly drafted, and it will require the Health Resources and Service Administration to collect detailed information on maternity care shortages within health professional shortage areas. Maternity care providers are already participating in the National Health Service Corps, and this legislation will ensure that these providers are sent to the areas where they're most critically needed. And I thank the gentlelady for yielding. I will yield back to the gentlelady.
And I yield back.
Chair thanks the gentlelady. Anyone else seeking recognition? If not, the question now occurs on forwarding H.R. 1209 to the full committee. All those in favor say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the bill is agreed to. Chair now calls up H.R. 1877 and asks the clerk to report.
H.R. 1877, to amend Section 520J of the Public Health Service Act to authorize grants for mental health first aid training programs.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. The chair recognizes himself for the purpose of offering an amendment in the nature of a substitute, and the clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 1877, offered by Mr. Pitts.
Without objection, the reading of the amendment is dispensed with, and the chair recognizes himself for 5 minutes on the amendment. This amendment reauthorizes an important grant program at SAMHSA that focuses on teaching individuals how to respond to a mental health crisis. This amendment has language that closely tracks legislation that passed the Senate in S. 1893, the Mental Health Awareness and Improvement Act of 2015. Additionally, this amendment brings the authorization of appropriations into compliance with House cut-go rules, and I urge my colleagues to support this amendment. Are there bipartisan amendments to the amendment? Are there other amendments? Is there any further discussion? If there's no further discussion, the vote occurs on the amendment in the nature of a substitute. All those in favor shall signify by saying aye. Aye. All those opposed, no. The ayes have it, and the amendment in the nature of a substitute is agreed to. Question now occurs on forwarding H.R. 1877 as amended to the full committee. All those in favor say aye. Aye. Those opposed, no. Ayes appear to have it. The ayes have it, and the bill is agreed to. All right, finally, the chair calls up H.R. 2713 and asks the clerk to report.
H.R. 2713, to amend Title VII of the Public Health Service Act to extend advantaged education nursing grants to support clinical nurse specialist programs and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. Are there bipartisan amendments? Are there other amendments? Is there any discussion? The chair recognizes Ms. Capps. 5 minutes to strike the last words.
Thank you, Mr. Chairman. Again, I will be brief, but I do want to highlight this important bill as well. Time and time again, my colleagues here on the Hill will tell me about the excellent nursing care they or a family member received. Sometimes it's a surgery in a hospital or some kind of medical event. And I've heard this is anecdotal, but I've heard them come back and say, well, my doctors were great, but you know who really came through for me? It was the nurses. So nurses, as is known, are the backbone of the healthcare delivery system, and we need to keep that backbone strong. And that's exactly what Title VIII has done for over 50 years. In fact, Title VIII is the primary program our nation has to strengthen and grow the nursing workforce by supporting nursing education at all levels, from entry-level preparation through graduate study. It does so through targeted investments in the recruitment, retention, and distribution of these highly educated professionals who comprise our nation's workforce program, nursing workforce. The programs also provide support for institutions that educate nurses for practice in rural and medically underserved communities. And it provides support for nurse educators so that they can be there ready and willing to teach the next generation of nursing professionals. It's very successful. From 2006 and 2013 alone, Title VIII supported more than 520,000 nurses and nursing students get trained and get into the field. The Nursing Workforce Reauthorization Act would ensure that these critical programs are available for years to come. And that is why it has the support of so many of my colleagues here on the committee, as well as from over 50 nurse organizations. I would also like to acknowledge my Congressional Nursing Caucus co-chair, Representative David Joyce from Ohio, who has joined me to lead this reauthorization effort, and I urge the full support of this important legislation, and I yield back.
Will the gentlelady yield?
Of course.
I thank the gentlelady for yielding, and I want to commend Ms. Capps for her commitment to healthcare workforce development programs. Clearly, the array of clinicians that make up the healthcare workforce are indeed the backbone of our healthcare delivery system. Advancing the state of healthcare in America requires a steady pipeline of the best and brightest minds entering the fields of both medicine and nursing across the country. I know firsthand how important the partnership between physicians and nurses is to providing the best possible care for patients. The vital nature of the physician-nurse team makes it critical that we continue to reauthorize health workforce programs and activities for physicians and nurses. Ms. DeGette and I are working on the reauthorization of the programs and activities in Title VII in the Public Health Service Act, which will ensure Americans have ready access to healthcare professionals across the country. I appreciate Ms. Capps' commitment to working with us to ensure that H.R. 2713 will reauthorize both Titles VII and VIII when that bill comes before the full committee, and I yield back to the gentlelady.
Thank you, and I yield back to the chair.
Chair thanks the gentlelady. Is anyone else seeking recognition? If there's no further discussion, the question now occurs on forwarding H.R. 2713 to the full committee. All those in favor say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the bill is agreed to. Without objection, staff is authorized to make technical and conforming changes to the legislation considered by the subcommittee today. So ordered. If there's no other business to come before the committee, without objection, the subcommittee stands adjourned.